Sir, the question is to Parthasarathi sir. With due respect, I'm not challenging your this thing, sir. My sincere question is, your thing, what I do the most, peripheral nerve block catheters. Fine. My apprehension is that it requires lot of technical skill, maybe multiple attempts to get the perfectness. And there is every possibility of infection percolating down, despite using, you mentioned tincture iodine. I have an apprehension whether tincture iodine can decrease the level of infection. One more thing, sir. The chances of dislodgement and misplacement of catheters are huge. And last but not the least, the anxiety, comfort level of the patient and the compliance. Your take, sir.
Patients are always complaint. Only we have to satisfy the surgeons. Patients want that only. We have to convince the surgeons that it is useful, that if they can mobilize it, you will have adequate relief. And you see, you work with a surgeon for 1 month putting catheters. Then the next time, if you don't put, you will ask, put catheter. That is how the patient responds to the surgeon. So that is about. Another thing I want to tell
Yes,
is.
sir, that's a compliment, sir. If the surgeon asks you to put the catheter again, that's a compliment to you because long time, 30 days. Madam said 45 days. Catheter, if it remains inside and the surgeon tells you to put it again, that means there is no possibility of infection. There is no possibility of dislodgement. There is no possibility of patient
Possibility is
complaining.
always there.
So I think hats off to you, sir.
Always there, no? Possibilities there.
One more question he said is, I'm not tincture, it is tincture benzoin. Okay? There are two. Tincture benzoin. There are two components in it. Benzoin is fixing. Okay? Tincture is spirit. So as soon as you spray it, you do this to make your alcohol evaporate after it does the work. Because alcohol and benzoin are the components of tincture benzoin. Okay, if you make the alcohol to evaporate, where benzoin sticks after it does the work of sterilization, then you fix the plaster. So you are going to be, if you don't do this and you are not waiting for the alcohol to evaporate, then you are likely to, this thing will be coming out.
Agreed, sir. But there is every possibility of microfilm being formed, sir. Microfilm being formed. That can produce another possibility of infection.
Every procedure we have the chance of infection.
When surgeon put us such an incision, na?
One only point, sir. Would you mind repeating the factors which you look for when you have a long time catheter? Infection is one. The dislodgement of the catheter is second. What else do you look for? I mean, you look for the skin changes or
Absolutely.
You look for redness and you localized edema. You always want to tell the patient that if you have any feverish feeling or even chills to report it to you because it may look okay, but the patient that may be beginning of an infection. And constant wound checks. And these days everybody has a phone. So it's not necessary that they have to come to your clinic. You can always tell your patient, take a picture and send it to me.
allergies don't increase.
Not really. If the patient is allergic to additives, then in the first place you might have to.
It may enter the one of the vessels. Sir, can it enter in of the nearby vessels?
Yes, intravascular. Yes, every time whenever you are topping up, you have to aspirate and then give. There is no doubt. I always instruct
silly question
aspirate,
asking.
give 3 or 4 ml and wait. Then after 10 minutes, you give another 15 ml.
Thank you, sir.
I think we can wind up the final session. I will not say it as a last session because it will retain in our memory forever. It cannot be last. So let us say it is a final session. So photograph the